This video was made possible by the Laurel Foundation, Bay Area Lyme Foundation, and the Limelight Foundation.
I was seeing a therapist at that time. She offered up another alternative and said, have you thought about doing functional medicine before? I didn't even know what functional medicine was.
Functional medicine, which I think some people have heard about because there's a Center for Functional Medicine now at the Cleveland Clinic. And functional medicine looks again to see what's going on underneath an illness, what's the function, as well as connections.
Naturopathic physicians, as well as the integrative medical doctors, look to the body's own innate capacity for healing and try to use natural form of treatments in addition to pharmaceuticals in both the diagnosis and treatment of various diseases such as Lyme disease.
So we look not just at the brain and neurotransmitters, but we look at how the brain's connected to other places, such as the gut-brain axis and the microbiome.
So you really get a bigger picture of what is going on. I worked with him on changing up my diet, trying to make a couple of lifestyle changes, and found immediate relief.
So when a patient comes to see me, first is to do the workup. I gather all the data that we have. I listen to all the symptoms. It's very important to listen to every aspect of the person's history. That will give me clues to how it has led to this moment where the person is as sick as they are.
Over time, what I've noticed is when a patient comes in, I will take an integrative approach to diagnosing and treating them. I'm not just looking for tick-borne illness. I may also be rolling out something like mold exposure or environmental toxicant issues like heavy metal issues.
Working with a functional medicine doctor, we first started on my gut. And so I changed up my diet drastically.
So when I'm working up a patient, I'll use conventional testing. But in addition to that, there are other pieces that are important. We also want to look at the history and the symptoms. And sometimes there is something even obvious in the history, such as a history of a tick bite that was missed because no one else had asked.
After about 45 doctors, I went online to an organization that is more functional medicine practitioners. I did a search for somebody in my area, and I thought I'm gonna start over because no one to that point had led me to any useful information.
There's the part of caring for the human being, because these people are sick. Many of them have had full-time jobs, lives, families, and everything is falling apart. We need to take care and look at this from the whole perspective, and that's the whole human being.
So I ended up in the hands of an integrative MD who really helped us look outside of the box so I could have some hope for actually recovering from this disease.
And I think the more natural integrative therapies that the patient is being supported with, they tend to do a whole lot better.
And he's the one that gave me an alternative idea that maybe you have Lyme disease. And so we tested for it and I came back positive, and it gave us an answer and some hope.